The prostate cancer treatment with the best cure rate and the lowest side effect risk is also the one most men never hear about from their doctor. Thousands of men have done higher risk cancer treatments because they didn't know this existed. I've done this procedure on over thousands of patients over the last 20 years, and I have the same conversation again and again because men with prostate cancer are making decisions with half the information. I'll show you the procedure most cancer doctors stopped offering, the numbers most men never see before they decide, and the one question that tells you everything about whether your doctor is giving you the full picture. Most men assume that if one treatment were clearly better, their doctor would have mentioned it. That makes sense. That's how most of us think medicine works. In cancer care, better can mean a lot of things. Cure rate is one, quality of life is another. Most visits focus on the first one and move fast past the second. When you look at both side by side, the picture changes. Surgery and external beam both land around 95% for prostate cancer that hasn't spread. That's the number most men hear. LDR brachytherapy comes in above 98% for the same group. Now look at quality of life. After surgery, more than 65% of men over 70 deal with permanent impotence. After brachytherapy, 76% of men keep their sexual function. If it was working before the procedure, there's a good chance it stays that way afterwards. Incontinence after brachytherapy is a fraction of what surgery produces. For intermediate risk cancer, external beam usually requires 6 months of hormone therapy. Brachytherapy hits a cure rate above 97% with no hormones at all. The procedure itself takes 30 minutes. You go home the same day. Most men are back at work the next morning. The treatment with the best cure rate and the lowest impotence risk is the one most men were never offered. These numbers are published. They've been in the medical literature for decades. Most men just never get the chance to see them. Ricky came to me at 59, fitness trainer in Atlanta. His PSA kept rising, and his surgeon told him surgery was his only option, that he'd be unable to work out for months. He flew to Arizona, had the procedure, and went back to his active lifestyle, cancer-free. Tom was 62, owns a pool cleaning company, intermediate risk cancer. He was told surgery was his only option and that he couldn't work for 3 months, which would have put him out of business. He had brachytherapy, no downtime, cured, still running his company. When you see these numbers, the question stops being, which treatment do I pick? It becomes, why didn't anyone show me this? Understanding why this treatment disappeared is the part that helps you make a better decision. If this is changing how you see your options, hit subscribe. Every week, I put out straight breakdowns of what the numbers actually show and what you can do with that. No spin, just what I've seen across thousands of patients. Most of the doctors recommending surgery or external beam are good doctors, acting in good faith. But the system they work inside shapes what gets offered. Here's what I see across the men who find their way to my office. They've already had a visit, sometimes 2 or 3. They got a recommendation, and somewhere in the back of their mind, something felt off. The visit moved fast. The other options didn't really come up. Answer these yes or no, based on what actually happened in your visit. Did your doctor mention LDR brachytherapy, the prostate seed implant, as one of your options? Did your doctor show you sexual function outcomes side by side for surgery, external beam, and brachytherapy? Did your doctor explain that intermediate risk prostate cancer can be cured above 97% of the time with no hormone therapy? Did your doctor walk you through how long you'd be out of work or unable to stay active for each option? If you answered no to most of these, you're not unusual. That's the visit most men have. Your doctor may still be right about what they recommended, but You may not have had the full picture when you decided. Next, what I actually recommend and why. LDR brachytherapy is the best treatment for most men with prostate cancer that hasn't spread. It has the highest cure rate. It has the best quality of life outcomes. And the reason most men never hear about it has nothing to do with how well it works. It fell out of favor because it makes the least money of any radiation option, because it requires a special license most doctors don't have, because the doctors who knew how to do it retired and the next generation never learned it, because cancer centers that own external beam machines have a financial reason not to bring it up. Above 98% cure rate. That's what the published data lands. For aggressive prostate cancer, there's a treatment called triple therapy, external beam plus brachytherapy plus a short course of hormone therapy. That gets you to 92%. External beam with hormones alone lands at 65%. Michael was 68 with aggressive high-risk prostate cancer. He was told he'd need 2 years of hormone therapy, would be impotent for life, and had a 65% shot at a cure. With triple therapy, he did 6 months of hormones, got his life back within a year, and was cured. Stephen was 85, first diagnosed at 79. He stayed on watch and wait for a while. Then his numbers rose, and a new biopsy showed his cancer had gotten more aggressive. I did the procedure in my office under local anesthesia, no hospital, no general anesthesia. He drove himself home. His brother had been a patient the year before. Stop assuming the treatment your doctor described is the only one worth looking at. Most men haven't heard of brachytherapy because most clinics stopped offering it, not because it stopped working. Start asking for the full comparison. Cure rate plus sexual function, cure rate plus bladder control, cure rate plus how long you're out of normal life. If your doctor can't walk you through that side by side, that tells you something. You can't go back and redo the visit you already had, but you can find out right now whether your doctor knows about this treatment and has a real reason for not bringing it up. Most bad treatment decisions happen because the comparison was never put on the table. One question asked before anything gets scheduled changes the whole shape of the conversation. That's what this question does. Most men make this call after 1 or 2 visits with incomplete information. That call affects cure rate, sexual function, bladder control, ability to work, and quality of life for the next 20 or 30 years. This question tells you fast where you actually stand. Here's what to do before your next appointment. The question: is LDR brachytherapy, the prostate seed implant, an option for my situation? And if not, why not? What a good answer sounds like, your doctor can tell you exactly why brachytherapy does or doesn't fit your case. They know the cure rates. They know the side effect data. Even if they're recommending something else, they can walk you through the comparison. What a bad answer sounds like, that's old technology, or we don't do that here, or a quick brush off with no numbers behind it. If they can't answer it, get a second opinion from a cancer doctor who actually does brachytherapy and does it regularly. That visit will give you things your current doctor may not have. I spent the first half of my career inside a general cancer practice. I saw what was being offered and what it was producing. At some point, I made a call. I walked away from a full practice to do one thing: build a place where prostate brachytherapy is the only procedure, every patient gets the full picture, and the recommendations is based on outcomes, not on what makes the most money. If you're making this decision, I want you to have that full picture. Now you have somewhere to start. There's already a video on this channel that goes deeper into something that comes up in almost every visit I have. Most men walk in thinking the decision is about the cancer. It's called "Your prostate cancer decision has nothing to do with your cancer." Here's what it actually is about. It's linked right here. Watch that one next.